which approximately 36 years.
Excuse me?
We own and operate
Microphone.
several, is that better?
Yeah.
We own and operate several local businesses. I'm here today because I believe this proposed restructuring is the wrong decision. Nearly 1 in 4 Chenango County residents is 65 or older, and every study shows that that number's going to grow. I looked up the New York State Comptroller Report 2023, and a quote there: growth in these 60 and older age brackets has been much greater than the state average. In rural counties, older New Yorkers face healthcare shortages, limited public transportation, and the loss of traditional support networks as many younger people are moving away. That's a huge one, because my father has passed, had Alzheimer's. My mom's in a home for Alzheimer's, as is my aunt. And I've felt this personally, not in this county, they're over in Schenectady and Albany County, but the loss of the traditional support networks as people move away, as young people move away, is going to severely impact our rural counties. The trend is clear. The senior population is growing, their needs are becoming more complex. As we know, Alzheimer's is just one of them, and that's growing tremendously, but there obviously will be other needs. The New York State Office for the Aging recognizes this, and they continue to develop new programs and services for older reports. I think our Board of Supervisors would do well to look to that agency for information and for advocacy. Locally, you probably all have seen the Chenango Valley Home is investing $4 million to expand aging care infrastructure, because they understand what's coming. They understand the future. So why is Chenango County moving in the opposite direction? Instead of strengthening the Area Agency on Aging, the board is proposing to eliminate positions and place this under the department. I'm going to say Department of Social Services, because I know it's going to be Health and Human Services, but we're moving the commissioner up, so it's going to be run similarly, in my opinion. So, placing that under the Department of DSS, this has the potential to reduce the focused attention, advocacy, and specialized services that our seniors receive today. And it's going to make it even more difficult to meet tomorrow's growing needs. Planning for an aging population means investing in transportation, healthcare, caregiver support, nutrition services, technology, and well-trained, knowledgeable staff who we have had for quite some period of time, who understand the unique challenges our seniors face and the special language that the gentleman was talking about over there. The Area Agency on Aging has built that expertise over many years. But one question is still unanswered. Why restructure now? I don't believe the board has really shared a good reason for this whole thing. The 2026 county budget has already been approved last year. AAoA, the Agency of Aging, was approved. It's in the budget. If this restructuring were truly about saving county tax dollars, it should have been proposed during the budget process, not halfway through the next fiscal year. In addition, the projected savings quoted by the chairman has been questioned after reviewing budget documents. I have not reviewed the budget documents. I am also working with the group that Leslie's working with. I've I've learned a tremendous amount about aging, the Agency on Aging here. And my understanding is the local share last year was minimal. So most of this funding is state and federal, not directly from the county taxpayers. Finally, before the board voted on this proposal back in May at the board meeting, every supervisor received a letter from New York State Office for the Aging Director, Greg Olson. And he explained that specific state requirements must be met before the organizational changes can occur. And it includes obtaining written state approval. Given that information, this is my opinion, I feel it was unethical for the chairman to present the restructuring resolution to the board. And it was unethical of the 6 supervisors that went ahead and voted for it. After they've been told the state has to approve it before the changes are made. So, given that information, I want to ensure or press upon the supervisors that the state requirements must be fully addressed so we don't jeopardize any state funding, since the majority of our seniors are being served with state funds, not county funds. Lastly, I asked, please leave the Area Agency on Aging as a standalone department. Continue investing in experienced staff who have earned the trust of the seniors, and begin planning for the future instead of reducing the very staff and possibly some services, because how can you possibly, if you're going to have fewer staff, you're just not going to be able to have the caseloads, and your wait times are going to be a whole lot longer. So, planning for the future instead of reducing the very staff and possibly services that our growing senior population will increasingly depend upon. Thank you.
Anyone else want to comment?
My name is Doreen Monahan, and I have to say thank you to everyone that works in Area in the Aging. They don't do it for the money. They do it because they care. And I am able to live in my own home with my animals because of you guys. I don't know, without Meals on Wheels and my insurance help from Aaron and everything else I've gotten from Area in the Aging, if I would even still be alive. I don't want to see anything change with the organization. I absolutely adore Aaron. And I'm assuming Aaron is up there too. I fell about a month ago, and if it wasn't for Sarah Moore, which I absolutely hate the fact that she's leaving, but
Me too.
but she helped me get up when I broke my knee. And so I absolutely adore these people, and I wouldn't want to see anything change for you. I like the idea of Aaron coming out to reassess me every year. Everybody seems to know what they're doing. So, I appreciate everybody. I've had an aneurysm and a stroke, and they told me I would never walk again. I'm walking. They told me I needed 24/7 care. I'm in my own home, and Aaron went above and beyond to get me my lifeline that works in my area. Yeah. I think you guys are wonderful. Thank you.
What I'm about to say actually started a career for a Nobel laureate. He based it on the fact that there was a dinner party and there was cashews out. And he did not have the willpower not to eat them all. So he put them in the kitchen. And gee, it worked. You take the nuts away from the person, you take them away from where they can see them, where they can go to them in their usual place. You're not going to eat the whole bowl all gone. They'll be in the kitchen, out of your mind. You're not going to see them. You're not going to utilize your services. You're not going to know what the trail is that you have to wind through to get to what you need. And most of the time I give up these days because do I have to have this app? Do I know where to go? No, I don't have the yellow pages anymore. That's how I used to do it. Do I have my family around me? Not really. Are they educated in this jungle that you want to call information? So when you tell me that you are putting the cashews away, hidden in another department, I'm hoping the phone numbers are the same. I'm hoping I don't have to go through 3 or 4 different phones that say, oh, you have to go here, you have to go there, you have to go to the other place.
Yeah, how are you gonna implement?
I couldn't believe it. I had to call a doctor's office the other day, and the whole thing was put on a list with 8 other doctor's offices. Okay, where's the person I used to talk to? So the whole thing here makes me more than nervous. I don't believe this can get better. I think you're going to have fewer people reaching out to get what they need. I know I've just experienced with my husband and I with surgeries and having to get to the hospital and getting proper care that he's 85. Who made my meal? Yeah, you got it. Nobody. You know, I had one leg and I'm supposed to do this. Right. Well, who are you supposed to call? Well, I'm afraid everybody's right. We are at the age where if you didn't work for it, you don't deserve it. I do not call anybody that says social worker. We did work for it. Long and hard. And in many different capacities. And some jobs were 24/7. Yes, they were. So please, you know, if there is still time to go back to the way it was, to perhaps do the paperwork required to make absolutely certain we don't lose any funding from the feds and from the state. I'd like to see more advertising. I'd like to see these services made more accessible to us, not hidden away in some other agency. Thank you.
Yes, you're part of the public.
Hi, my name is Robert Wanzer. I'm the current supervisor of the town of North Norwich, and I'm just here to, I'm a senior citizen too, I'm 67, and so I've gotten help already from an agency for getting them to Part A for Medicare, but I wanted to be clear that every supervisor in this county wants to continue the services that are necessary and appropriate for our agency on the.
How can you do that with
There are
those
so
people?
many circumstances that happened earlier this year that created a big fire that had to be put out. And our Department of Social agency on the agency, you know, area agency on the agency. It's agency.
We just changed
It
that
is
back.
it is a human service. And that's just the intention, to bring, not become another social services, but to become under the umbrella of human services. No diminishment to area agency on the aging. There'll be a little bit of reshuffling, but the outreach that's gonna happen is not gonna be any different. It may even be better, because it's going to be better, because
You're eliminating.
Michelle just
outreach
said, no,
workers
Michelle said hope, and you're still cutting 5
will
positions.
not have to do the paperwork as well. There'll be a senior that all the outreach workers will answer to. We're not looking to diminish any services, we're looking to, and it's not about money, it's about maintaining service to our people. to our
How
citizens.
can you
Because
maintain
it's not
services
a
with
financial
less
issue.
people?
It is reshuffling so that it's not top-heavy anymore, and you can focus more, the outreach workers can focus more on reaching out to you. And so, please, as a supervisor, and I think I can speak for most of the supervisors, that we all care deeply about our seniors and want to see them receive the services that you deserve and should have. And our group here will continue to provide. But there was a series of circumstances earlier this year which cannot be discussed publicly that kind of got this ball rolling.
Personnel issues that can be handled by HR,
It should have been.
Thank you.
not by
Thank you. Anyone else have any?
Hi, good afternoon. My name is Bob Jeffrey. I'm the City of Norwich Supervisor and also a senior citizen as well. This is the first time I've been here, and I apologize for being late. But got to ask a question. My understanding was, when it was posted in the newspaper, that this is a yearly review. Is that correct? I know maybe you can't answer it, but it was printed in the paper. Is this correct?
Yes.
So last year, this is the first time I've attended one. What was the attendance like? Was it a lot of questions or not? Was there a
It
lot
was
of
at
people?
the fair. It was at the county fair.
There was a lot of people there?
Oh, a lot of people.
Oh, there were?
Oh, yeah.
Well, yeah, because they do it on senior day.
Because they do it on senior day at the fair,
Okay.
So it's free admission to the fair, so there's lots of them already there.
So
they can go
my
along.
question is, last year, how did things go last year? Were people bringing a lot of complaints that things got to change right now, instantly, the whole thing, were there complaints?
It wasn't a meeting. It was just a public hearing,
It was a public hearing, classified as a public hearing.
but everybody that was at the county fair, at the senior center, in the bingo tent,
Yeah.
they listened. A lot of people, I don't remember any questions because I was always there, but a lot of people were complimenting. That's what they were doing. They were giving compliments. They were telling Heather, the person that was the director, how well the agency was doing. That's what the people were doing.
And so now, that's what
Some
I'm hearing
positive
as well from people here. I don't sit on the Health and Human Services Committee. I did initially when I became a city supervisor. But one of the comments that the person made here was, the purpose of the area agency on aging is to allow and to help keep people in their homes. And the reason why it's important is because if you don't, now who has to pay for that? Okay, it goes to Medicaid, not Medicare, Medicaid, which costs money. So there is a return on investment by having the area agency on aging. So this year, I'm just listening as an observer, but I have not heard any comments. I know Supervisor Wanzer said we were in a firestorm. I don't know anything about it. I don't sit on Health and Human Services, but, so there were no requests last year for the people that attended to have major changes. Were there or weren't there? No major changes requested. So I would like to know who initiated this. Was it the Area Agency on Aging?
No.
The Health and Human Services Committee? Was it the Area Agency on Aging?
It was not the agency.
Because they
Okay,
found out through the paper like we did.
all right.
Yeah.
The
And
officials, who were the officials?
Who were the officials that said, we gotta do this? That's what I don't know. I'm a city supervisor. I said, I'm the board of supervisors. I don't know myself. All I know is it was received, or had a resolution around end of May, April 1st, and it was, or May 1st, it was then changed. And I'm not gonna make a decision. I don't do knee-jerk reactions to something unless I'm involved with it and understand it. But my concern is, I have had so many phone calls, as well as emails, conversations with people, is causing a lot of stress and a lot of trauma for folks. And that's not healthy, okay? And there's a lot of services that are provided, and I can understand why people are concerned, because there's Meals on Wheels, there's Lifeline, like you mentioned over here, and people want to know that they can stay at home. That's very important. So I haven't been convinced. At first I heard it was the money. That's what I understood, Supervisor Wanzer. It was a cost savings. That's what was explained. I don't see that. And I've been in private industry. I have looked at spreadsheets. I know return on investments. I know everything. There is no savings, okay? It is run very efficiently, and the people that I'm hearing from do not want this. They're saying, not now.
Not ever.
Just leave it. Please leave it. So
They need more
that's what I'm
people,
hearing,
not
and I would
less.
convey that on behalf of the constituents that I represent. Thank you.
Hi, it's me again. To expand a little bit on Mr. Jeffrey's comments. Online, when this all literally blew up, the end of April, beginning of May, there were at least 200 comments on different Facebook posts
That's how I heard about it.
regarding this, and it was all fear
They just took it.
and why. Neither of those things have been placated yet. It hasn't been explained why mid-budget, why at all. And the fear, because we're hearing from professionals in finance, professionals in employment, HR, budgeting, it has not been explained why, or how it will save, or what it will improve. 10,000 sailors can't be wrong. Okay, it's an old saying. You've got 10,000 sailors sitting here making comments online. We had over 700 people sign our petition without actively trying, okay? We were not out on the streets begging people to sign this thing. They came to us. At least 300 of those who signed asked, why are they doing this? And all that is saying, because they're shaking their head while they're saying it, is increasing their suspicion of our elected officials. Okay? Because you're not communicating with those you are affecting, which really is the entire community, not just the over 60.
Transparency.
We're missing, where's the transparency?
Yeah.
So,
What's going on?
so if for no other reason than your political careers, you need to put a stop to this. Truly think it out. Parse it out as finely as you possibly can. Come back to the people, apologize for doing this under the cover of darkness, and represent it correctly. Pushing it through next month, July 13th, everybody, is the next board meeting.
HHS is on Monday at 10 a.m.
Right, but the rumor is Mr. Blanchard is going to try to push this all through come the board meeting on July 13th. Please show up.
Yeah.
Our pressure makes a difference. But again, going back to your political careers, whatever you want to call it, I am sure that you all started out of obligation, the feeling of obligation to do something for your community. Your community is sitting here asking you to not do this. And yet, you get heavy sighs from Miss Monroe sitting back, shaking your head, folding your arms. If you're that bored, please leave. Because you're insulting everybody by behaving that way.
Thank you.
That's it.
Good afternoon. My name is Patty Murray. I am a past supervisor. I am a past employee. I've worked in this county for 38 years. There are at least 7 supervisors in this room that I've worked very closely with, and to the best of my knowledge, they are working very hard at this. I know it's frustrating. I know it's scary. I am also a senior. But a lot of it is a lack of knowledge on all of our part, and I'm going to say it on mine, because there were personnel issues, to the best of my knowledge, that brought this to head, okay? So they decided that this needed to be brought forward. Having said that, there's currently, like I said, 7 supervisors in this room out of 23. That's a little upsetting to me. This is a very important issue. I really thought it would be more well attended, but I do appreciate the 7 that are here, because they have all worked very hard at this. They wouldn't be here if they didn't care. Also, we have 2 past supervisors here. We have several past county employees here. And we understand the value of this agency. In my opinion, if this was about financing, you're gonna have to bear with me because I'm not here any longer. That if this was about financing, if this was about money that needed to be saved, I think that would have been much better if you took 1 employee, eliminated 1 position from nine different departments, if that's what needed to be done. But downsizing 1 department by 9 people, which I know this is an evolving situation, and I know that it's going to change. It's gone from 9 to, well, now we were gonna get rid of 2, now we're gonna get rid of 5. It's not done yet, okay? There's still several places that needs to go. It does need to go to the state to get their approval. It is very upsetting, as for having worked, I was on Health and Human Services Committee last year, and the year before. It's not an easy committee to be in. Finance is not, personnel, none of the committees. The supervisors do not make, they make a little over $16,000 a year. That's not a lot of money. They do put a lot of time in and a lot of effort, and they do care about these communities. So it's hard to sit here, I couldn't sit here and listen. I know it's upsetting. They've got to give us more information. And I think that if given the opportunity, they will explain this in a better light. Like I said, there was a major personnel issue to begin with, and that I believe that's what escalated. I don't believe this was well, I know it wasn't discussed last year because I was on committee. So this is something that evolved this year, and I think they're still moving forward. I'm hoping that these 5 positions are not going to be eliminated. I don't think if you do need the financing, then like I said, go each department, 1 DSS, 1 mental health, 1 Department of Public Works, 1 county clerk, 1 treasurer's office. Just go right on down the line. And if you need 1 position, rather than attacking 1 department, because I really think these people really try, and from what I'm hearing, and I've learned a lot. I just became the vice president of the Chenango County Senior Council, and I've learned a whole lot of information in 3 months. And I think it's very imperative that this keeps getting looked at and more examined. I don't know how soon the decision will be made. I don't know if it'll be made at next board meeting. I'm hoping that it'll be tabled again until this can be figured out. They can table it, and they can still research it and go back to your committees, personnel, finance, health and human, and really look at this, because it is going to impact several people. And the statistics you're talking about with the increasing volume of seniors is alarming. It's great that we're living longer, okay? But it's alarming when we don't have the services here. And so, but that's my opinion, and I thank you for letting me to speak.
everyone. My name is Diane Scalzo. I'm also a past supervisor and served on HHS, also with Supervisor Murray. Under the leadership of Supervisor McNeil.
Can't hear you.
There you go.
Thank you.
Thank you. Okay, starting over, we're used to having our own mics. And this is, well,
You can take it right out.
all right, I'm a past supervisor, Town of Columbus, served on HHS along with Supervisor Murray under the leadership, the very capable leadership of Supervisor McNeil. I'd like to refer everybody to this worksheet. I am a past supervisor, so I have not been involved with any of this discussion. I don't know what happened at personnel. I have not been involved at all with redesign. All right, if you look at 2026 personnel costs versus services expenses, the current is personnel and fringe, $916,000. Proposed would decrease that to $808,856, so there's some savings there. Services and expenses, almost $939,000 currently. That would increase, so services would increase to $1,046,271. Money's coming off personnel, it's going to service. What has everybody been talking about? They've been talking about service and worry that service is being cut. This would indicate that more money is going to service. $107,500 is coming off personnel and fringe and going to service. We've been told that yes, there will be a reduction in staff, but they're taking away admin duties. So how is it gonna work? They're not sitting at a desk, they're out there taking care of them. Increases to personnel care, 25%. That would be an additional almost $54,000. Increase to nutrition, again, almost $54,000. Is there anybody here who does not want more money to go to nutrition?
The question is that you're going to reduce your outreach workers. So when you do that, one outreach worker cannot handle the clients of two outreach workers. So if you put additional money into in-home services, the client is not going to be able to get an appointment with somebody for at least a month because everybody's going to be bogged down taking everybody else's caseload. So I don't care if you put $100,000 in there, you're not going to be able to spend it.
I can't speak to. These people are in charge of how that design works out. If they say they're going to do that, I'm trusting that they're going to do it. They're going to have the money to do it. If it turns out that they do not have enough staff, their next step is to go back to HHS and say, this is what we need.
So our seniors will suffer for months and months?
And you want us to trust
For you guys to
that if
feel
they
like, oh,
go
yeah, I
back
made a
to the
mistake?
supervisors
Okay,
and go to
so-
HHS, the HHS is gonna go, oh yeah, I can tell that you need more.
Or they'll say, wait for next year's
We
budget.
certainly don't trust them
When you
now
guys made
after
the
all of
mess
this.
up?
Next year's budget starts next month.
Yep.
So I mean,
So you do next year's budget and you do it next month. So what happens if, say, in June of next year, you need 2 more outreach workers because you can't handle a caseload? Oh, well, you have to wait until you do 28 budget. Is that what you're saying?
I don't know how the budget works for that. I do know that they have contingency budgets and that they also have,
But that's if you guys decide to vote for it.
And actually let the Office for the Aging have additional staff because they need
You're
it.
telling us to trust you guys, for you guys to vote more people back in when you guys are the ones that are gonna be voting to cut these people out.
Yeah. And-
So we're supposed to be like, thanks guys for fixing your error when we told you not to do this.
No.
This reorganization has been with coordination with the aging
After.
agency.
After. You
Hold on.
didn't involve them.
This plan right here has been in coordination with them. So they've said this plan is gonna work for their department. It's gonna work. It's coming from them that this is going to work.
Who is them?
Agency.
Michelle hasn't even been there a whole year yet.
She said she's hopeful. That doesn't mean she is 100% sure that she's gonna be able to do this.
They've been in
All right, this
discussion.
is not a debate. This is what we need for the state. We're just giving out the information. We're not gonna go back and forth. That's not what this is about. You can reach out to your supervisors if that's what you need to do.
But the supervisors don't listen to us.
I hope the ones here will make it apparent to all the rest of them that they need to answer you. That's
They do.
part of their job. But if there's no more comments, then I think we're good.
No, I have something to say.
Yes.
I worked there a long time, and you guys are the best. And I
Yeah.
can't imagine that Aaron, Beth, Mindy, and Pat want to lose that title of senior outreach. You guys deserve that title, and you deserve the outreach workers underneath it too. And maybe by budget of 2028, maybe you'll be able to get another 2 workers. I remember my stack of paid messages that I couldn't get to because we didn't have enough time. We never had enough time. But now we don't even have paper messages because everything's on the phone. Which, it's okay. But remember, Pat and Mindy and Pat and Aaron, you're gonna lose that title. You don't wanna lose that title. You guys deserve that title. I deserved the title when I had it too. And you guys all deserve it. I can't believe you said it was okay for this to go through. You do not want Mr. Allwater as your director. You had problems with your previous director. You're gonna have even more problems. And I know some of you that work at Area Agency on Aging, you came from Department of Social Services. You hated it there. And he was the director then. I don't know how you can say this is a better thing.
I don't think we want to go into personnel issues and make personal attacks. That is
Well, somebody else said Allwater earlier, so that's the only reason I said it.
Well, let's